طيب بسم الله الرحمن الرحيم والصلاة والسلام على أشرف خلق الله أجمعين. Today inshallah I'm going to talk about or to examine how to examine the rheumatoid hands. Rheumatoid examinations, you are going to start by the complaint of the patient. If the patient came with shortness of breathing, start with the chest. If the patient came with pallor anemia, start by to check for the pallors. يعني respect the patient concern first. Then after that come to the hand examinations. Hand examinations I will start by the following. Number one, inspection. By inspection I will inspect dorsally for any deformity. Focus here please. Here if you focus with me, I will look dorsally. There is Z shape of the thumb. There is bow to near deformity. And there is slightly ulnar deviation of the hands. There is ulnar deviation of the hands. Focus so as to not invent findings. Digest the deformity of the hands first in your brain. There is one. Move your hand like this. Focus with me. You can move your head like this. This is deformed. This is one neck. This is ulnar deviation. I finish it. I will look for guttering. If there is wasting here, then I will look to the palm. In the palm, look for palmar erythema and wasting of the hypothenal muscles. Then look for if there is any scar for split. After that I will finish my inspection by looking for what? For rheumatoid nodule. There is no rheumatoid nodule. Then after that I will come to the what? To the second step, which is palpation. The first thing, this palpation is temperature. 4 T's. The first T, temperature. Here and here. The second T is tightness of the skin. I will take a skin pinch here, also skin pinch here. If the patient is mixed connective tissue disease, as example, if it is mixed with systemic sclerosis, that means I am dealing with overlap syndrome. That is why we will take a skin pinch here, If it is the skin is tight, that means this is overlap. If it is thin, that means this lady, she is on steroid. Then I will come to the second T, which is the third T, which is tabbing. If I tap here, there is any pain, to give the examiner impression that you are checking for carpal tunnel syndrome. In case if the lady she said to you yes or no, don't tap. Because if this patient she said ah, you will say ah instead of her because of welfare. And you might be the first one who tap her in her wrist. That is why don't tap, just to show the examiner that you looked for carpal tunnel syndrome. Then the fourth T is tenderness. Do you have any pain anywhere? If she said that she has pain here, that means these 2 fingers should not be touched at all. You got me now? Imagine that she said that she has pain here and here. The presence of pain inside these 2 fingers telling me that this is active synovitis. I will start by palpation like this maneuver. Like just you are going to put a ring in her fingers like this. While focus with me, I'm going to feel for palpation, my eyes should be in her eyes. If by mistake the examiners notice that you are doing like this, don't blame anyone other than yourself. Don't touch the hands of the patients unless your eyes put it in the eye of this patient. Is that clear? Here I will do like that. Focus with me here also. Not all the finger, you can do like that also here also. Then in the wrist also. Then after that, if this is, as example, if it is bony like that, if it is bone strong, if it is hard, this could be chronic. If there is effusion, just like balloon, your fingers is going like this, that means this is active what? Synovitis. There is effusion around the joints. I finish the 4 T's. Again, the 4 T's, number 1, temperature. The second T is tightness of the skin. The third T is tabbing. If I tap here, there is any pain. The fourth T is tenderness. Do you have any pain? Here, yes, I will come here. Then I finish my palpation. I will say to her by what? By proximal myopathy. Do like that. أعمل كده. This is proximal what? Proximal myopathy. I finished the hand of this lady. Then I will come to the function. The function, focus with me. 1, 2, 3, 4, 5. Number 6 is give her the coin to pick it out. Okay? Then can you do for me like that? If you smell carpal tunnel inside this lady, take permissions. Excuse me, boss, I need to do the funnel test because this lady might have a pain. Because if the patient, she said that she has a pain, this is probably if she is in pain or showing any painful features, this is might be a welfare problems. Excuse me, boss, I need to check for prayer and inverted prayer signs. Do like that, please. Yes. This is number 3, number 4, number 5, number 6. Here also. Here I finish again. يلا ها بلاي with me. العبي معي. 1, 2, 3, 4, 5. طيب 5 here. Then the number 6 is by what? By coil. Then I will come to examine from above down. Don't focus in the face. I will come to the jaundice. Above the eye is jaundice. Below the eye is pallor. Jaundice, that means you are looking for other autoimmune hepatitis, primary biliary cirrhosis, primary sclerosing cholangitis. Pallor for pernicious anemia, autoimmune hemolytic anemia. In the center of the eye by the torch, looking for itis, scleritis, conjunctive anterior uveitis. You got me now? In the eye, 3 steps above the eye, below the eye, in the center of the eye. Then I will come to the mouth. Open your mouth for any mouth source. Then I will come to the chest. In the chest, 2 anterior, or 1 posterior, and at least 2 anterior. Posteriorly, I will come directly to the base of the chest to look. Take deep breathing. Breathe in, because to look for fine crinkles of pulmonary fibrosis. You got me now? As soon as you hear it, ask the patient to cough. Is that clear? Then the second thing is, don't examine above the clothes. My advice for you is station 5. By stress, you can do everything. Don't examine any patients in station 5 or any exam or any station above the clothes. Again, the second advice in station 5, if you lost the senses, don't take history. Give me a stethoscope, please. Give me a stethoscope. If you lost the senses, don't take history. Because, focus with me here, what is happening inside the exams. You are going to take as example, you are going to any one of the family has similar condition. Do you have any drug history? What is your medication list? Do you have any family? Wallahi, having like this in the exam. While the stethoscope in you are going, don't take history if you lost the hearing sense, and don't take the history if you lost the vision sense, like this. Do you have any family history? Any one of the family? Anyone? Is that okay? Then after that, to 1 anterior for basal crinkles. Then you come to the posterior basal crinkles, anterior for palpable B2. Then after that, I need. It is better to auscultate quickly for mitral, tricuspid, pulmonary, and aortic area. Dubai, by the way, they have a case having aortic or rheumatoid arthritis have ejection systolic edema in the aortic area. Then after that, come to the abdomen. In the abdomen, I need to do abdominal examination, looking for what? For any organomegaly. Which is organomegaly? Splenomegaly. Then after that, come to the joint, to the knee. I mean, if the time is allowed, go and do inspection of the of the knee by. This is another session. Just at least touch if there is any knee swelling. Then after that, look for crepitations. Present your finding. The presentation of rheumatoid arthritis, 3 steps. Step 1, step 2, step 3. Okay? Step 1. This lady, she has got features suggestive rheumatoid arthritis deformities in both hands. In the both hands, she has got findings, or she has got a signs of rheumatoid arthritis deformities distributed in both hands. This is the first step, in the form of swan neck deformity, if there is, boutonniere deformities, ulnar deviation, and Z shape of the thumb. Give me the second step. Apart from that, the activity of the disease. There is evidence of active synovitis or active rheumatoid arthritis based on there is hotness in her hands, or there is pain in the lateral 2 fingers, because she said to me she has got pain. Apart from that, the hand function is preserved or impaired. But the presentation of rheumatoid arthritis in the exam, they need from you 3 stations. Station 1, deformity. Station 2, activity of the disease. Station 3, the hand function. Again, present your finding. On examination of this lady, she has got rheumatoid hand deformities in both hands, in the form of swan neck deformity, boutonniere deformity, ulnar deviation, Z shape of the thumb. Apart from that, when you say apart from that, you are going to the second station, which is activity. There is signs of active rheumatoid arthritis based on there is tenderness or there is pain, as she said to me, in the left lateral 2 fingers. Presence of pain is telling me this is active disease, and there is, as example, there is hotness in her fingers. Apart from that, the hand function is preserved or impaired. Based on what you said, because inna is here, if the patient, she cannot pick up the coin or what, you notice that she cannot do, this is the hand function is impaired. I hope that is clear. Clear? Then later on, discussions of investigations, plan of management, if time out. Thank you.